Pollution is a leading cause of premature death, killing 9 million people a year. That's more than all deaths from war, malaria, TB, AIDS combined. And yet the issue is receiving 10 times less funding. Pollution is inherently at odds with the notion of sustainability itself, yet it's getting worse. And until relatively recently, no one was talking about it. The Global Alliance on Health and Pollution is changing that by drawing attention to the problem and helping countries implement solutions. In 2015, GAHP secured Target 3.9 in the Sustainable Development Goals. And in 2017, we co-authored the Lancet Commission on Pollution and Health. This report outlined for the first time the enormous costs of pollution and changed the conversation globally, paving the way for country-by-country responses. In 2017, GAHP launched the Health and Pollution Action Planning Program to enable typically siloed government agencies to work together, often for the first time, to understand pollution problems in their country, and more importantly, to prioritize where to start first. GAHP has been flooded by requests for health and pollution action plans. In Madagascar, for example, where 1 in 3 people die from pollution, the Health and Pollution Action Plan resulted in a broad coalition of local, national, and international stakeholders to fundraise to implement a 5-year plan. When it's implemented, the Malagasy Health and Pollution Action Plan roadmap will enable the country to reduce exposure to pollution, improve the health of all of its citizens. Pollution comes at enormous cost, and yet these impacts are actually preventable. GAHP was established to create a global movement to inspire others to act. Every activity that GAHP undertakes is meant to protect children, future generations, vulnerable populations everywhere from needless exposures to pollution. Expanding the Health and Pollution Action Plan will accelerate progress in many countries. GAHP is leading global action on pollution. Its Health and Pollution Action Plans aren't meant to be reports that gather dust. They fill an urgent need, and they're meant to be implemented. They're meant to save lives, and that's why we exist.